Welcome to Brave and Curious, the podcast where we do a deep dive into fertility, reproductive health, and wellness with science and compassion. I'm your host, Dr. Lora Shahine. Let's stay brave and curious together. Today, I am curious about the semen analysis. The semen analysis is often one of the first steps recommended to a couple that is struggling to conceive, but the results can leave people confused. With up to 50% of infertility associated with male factor, understanding your results is key to learning about your reproductive health. And today we're going to learn more. You're going to learn why we do a semen analysis, what we're looking for, what is normal, what is abnormal. You're going to learn what causes abnormal results, and you're going to get some advice on what to do if you get abnormal results. I'm going to finish with some questions you can ask your doctor as you're going over the results with that person. First of all, the semen analysis is an absolute essential part of a fertility evaluation if a couple is trying to conceive and they are not getting pregnant. Do not skip this one test. Too much of the time, people focus on the person with uterus and ovaries and just assume that anything that has to do with fertility has to be that person's fault. But male factor infertility is a part of an infertility diagnosis and a part of an issue up to 50% of the time when couples are trying to conceive and it's just not happening. So no excuses. Even if you've caused a pregnancy in the past, even if you have no health issues, even if you have no difficulty ejaculating or sexual performance, or you have no symptoms, you should still do a semen analysis because you could still have a low count or even no sperm. That's called azoospermia. 5% of couples with infertility will have absolutely no sperm when they look under the microscope. It's rare. It's really unlikely, but you just don't want to miss it. So no excuses. If you are nervous about doing a semen analysis, that is normal. And if your partner is nervous and trying to find excuses and just was like, I just really don't want to do it, don't shame that person. It is really awkward. It's totally normal. And there's things that you can talk to your clinic about. And so I'm going to walk you through it one step at a time. So first of all, when you get the semen analysis and you're looking at it and you see all these numbers, I want you to understand what we're looking for. And every lab report is going to be a little bit different. So this is a report from my clinic, Pacific Northwest Fertility in Seattle. Names have been blacked out, but this is what a report looks like. And there's all these numbers. And then you also have kind of the normal numbers that are to the side. The main thing that we're looking at and what we really want to make sure with a semen analysis is there sperm? How much sperm is there, how much of it is moving, because only moving and swimming sperm can get up through the reproductive tract and find the egg to fertilize. And then we do look at morphology, or the shape of the sperm, and that's actually the most common thing that's abnormal and actually the least predictive of fertility. So I'm going to walk you through step by step, but this is what a semen analysis looks like. And so I'd love for you to get yours in front of you and let's look through. Now, every lab has their own standard and exactly what they're looking for. So they really should put what normal values are and what their guidelines are. Most labs use the World Health Organization guidelines for what normal counts and normal motility are. And then as far as morphology is concerned, most fertility clinics will not use the World Health Organization criteria for normal shape of sperm. They will use something called Kruger strict criteria. And so it's important to understand a little bit about exactly what your lab is doing and realizing just a little information here. If you really are doing a semen analysis for fertility purposes, I highly recommend, if it's available to you, getting the semen analysis done in a fertility clinic because they do it all the time. They are going to be the most proficient and kind of in general going to give you the best, most accurate results. So I'm sure that there are other types of labs out there that do a great job, but just in general, if you could do it with a fertility clinic, that's the best way to go. The first thing to look at with a semen analysis is the volume, or how much stuff is coming out. The ejaculate includes not only sperm, but also secretions from the prostate gland and other glands along the male reproductive tract. A normal volume is about 2 to 5 milliliters. So if you're looking at your semen analysis, it'll say volume and it'll usually be reported in milliliters. If you have a low volume, if you have less than a milliliter of ejaculate, we think about a couple of things. Number one, maybe there was an issue with collection. It may sound silly, it might make you giggle, but sometimes people miss the cup. and they don't collect everything. And so it's important to report that when you're handing in your specimen, because otherwise the clinic might assume that there's something else wrong. So it's okay, and it happens, and it happens. So just let us know. The other thing is that there could actually be a blockage along the male reproductive tract, especially on this tube called the vas deferens, that isn't allowing all the secretions to kind of come out. So those are a couple of reasons it could be a low volume. The second number that we look at is concentration or sperm count. And what that means is, of all the stuff that comes out, how much of it is actually sperm. And this will be reported in million per milliliter. And so it'll say sperm concentration, and a normal sperm concentration is over 15 million sperm per milliliter. And that will usually be on your report. Reasons that people can have a low sperm count are so many reasons. Again, it could be a collection issue. It can be you missed the cup, or it could also be that you didn't follow directions for when you were getting ready to do your specimen collection. So follow the directions, because if you ejaculate on the same day as your sperm collection, or even the day before, then it can look like you don't have a lot of sperm, but it's just that you kind of emptied really close to the time that you were doing the test. And so most of the time, most clinics will say, don't ejaculate within 2 days of the specimen collection. But the other thing is, you do want to ejaculate within a week. So these are what these numbers come from, like these normal numbers come from, is they set guidelines and said, okay, for people that are collecting within 2 to 7 days of ejaculation, this is what the normal numbers should be. So if you have a low sperm concentration, it could be a collection issue or not following directions for abstinence before the test. There are so many other reasons you could have a low sperm count, specifically medical illness. It could be a chronic illness like diabetes. Diabetes can be associated with low sperm counts. Obesity can be associated with low sperm counts. It could be a recent illness. So a really high fever, recent cold, pneumonia, COVID. Sperm is being created on a 2 to 3 month cycle. And so sometimes when we get a really low count, we'll talk to the patient and say, hey, do you remember if you were really sick within the last 2 or 3 months? And they'll say, oh yeah, I actually had pneumonia, or I had a really high fever for a few days. And so sometimes it's just a temporary drop in count, and it's really just you got to recover from that illness, and the normal counts will kind of come back sooner rather than later. Another reason people can have a low sperm count are ejaculation issues. There's something called retrograde ejaculation, where the sperm actually it's coming out along the male reproductive tract, and that's actually really close to the bladder. And sometimes there's a valve that doesn't sort of shut off the way it's supposed to. And sometimes the sperm can actually go into the bladder. And then what's coming out with ejaculation is actually more of the secretions. And so if you have a low count, that's something to ask your doctor, like, hey, could this be retrograde ejaculation? Could it be a collection issue? Could it be a chronic or recent illness? These are all kind of things to think about. Other things that have been associated with a low sperm count are hot tub use and saunas. I know that sounds really funny, but it's actually true. Less worrisome about like boxers versus briefs, or, riding bicycles, unless it's like really long, serious training for like Ironman or something like that for a bike. But actually regular sauna and hot tub use, really high heats can actually decrease sperm count. An anatomic issue that can decrease sperm count is something called a varicocele. This is a dilated vein within the testicle that's actually heating up the testicle. So heat is not good for sperm production. That's why saunas are bad. That's why hot tubs are bad. Some toxins have been associated with a lower sperm count. Certainly tobacco and smoking and vaping have been associated with lower sperm counts. Chronic alcohol use. I have a whole video here on YouTube all about alcohol and fertility, and having a little bit of alcohol every once in a while, part of celebrating, going out to dinner. It's just a part of being social is fine. Most studies say is fine, but chronic and regular and heavy alcohol use and pretty regular binge drinking can absolutely affect sperm production. Another thing that people sometimes do to relax, and you kind of wish it was completely natural and fine, but regular marijuana use can affect sperm counts and function. I have another video here on YouTube all about cannabis use or marijuana use and about fertility. I have one on how it affects sperm and another one on how it affects people with uteruses and ovaries. So go and check out those videos too if you want to learn more details and review the evidence on that. Some other toxins, like we think a lot about exposures to plastics, bisphenol A's or BPA, parabens, phthalates. There's a lot of chemicals that are in a lot of products and things that we use on our skin, etc., that have been associated with poor reproductive health. One last cause of a low sperm count that's really important to understand is exogenous testosterone. So what I mean is taking testosterone or steroids, whether it's for bodybuilding, or a lot of people are given testosterone because they're tired or they have low libido. A lot of doctors will prescribe testosterone to men for a lot of different reasons. But what a lot of people don't understand is that if someone takes testosterone, then their own body starts making its own testosterone, because it's kind of like, oh, well, I'm seeing it come from a cream or a shot or patch or whatever it is. Then the testicles stop making their own testosterone. And guess what else they stop making? Sperm. So I've absolutely seen people come to me, hey, we've been trying for a year or two to get pregnant. We've seen another provider that figured that my sperm count was low, my testosterone was low. So I've been taking testosterone in order to improve my sperm count. Oh my gosh, that's the opposite. It's like giving a guy a birth control pill. And so really important to realize that you should not take testosterone if you are trying to conceive, because it will shut down your own sperm production. Very often it will come back, but it can take 3 to 6 months to really see a return to that normal level. So that is a really important point to take home with you. So there's lots of reasons that people can have a low sperm count. And so part of getting this information is learning why. And so make sure you talk to your doctor about that. So we talked about volume. We've talked about sperm concentration or count. The third thing that we're going to talk about is motility. And this is the percentage of sperm that's actually moving and swimming. And that will be presented as a percentage on your report. And it'll say percentage, or it's like mobility, and then it'll say blank percent. So normal is 40% or more of the sperm should be moving. When we look at it under the microscope, that's considered normal, and anything less than that is considered abnormal. So why would you have a low motility? Well, all of the things that we went through that caused low sperm count just a minute ago can also be associated with low percentage of motile sperm. There's one other thing that just is important to talk about again, is if you don't follow the abstinence directions for the sperm collection, that can change motility as well. So some patients will try to hang on to their sperm because they want to ace the test. You know, get a semen analysis, you sort of feel like you're being graded, and you're like, I want to kill this exam. I want to do great. So I'm not going to ejaculate for a long time before it. I'm going to have tons of sperm and it's all going to be great. And so if you don't ejaculate for like 8 plus like 2 weeks or whatever it is, because you want to do it within 2 to 7 days before the sperm collection, if you hold on, then you might have a high count, but a lot of the sperm is going to be dead. A lot of it's not going to be moving. So you could have a high concentration, but it'll be a very low motility. And so I just want to let you know that. Also, if you ejaculate really close to the time of the sperm collection, then you can have a really low count or low concentration, but a really high percentage of moving sperm because they're like fresh and like ready to go. So follow those directions. We're going to get back to learning more about the semen analysis, but I want to remind you just how important it is to follow the show, rate and review wherever you are listening. It really helps others find this valuable information, and it helps the show grow. Now back to learning. The fourth number that we look at really closely when we're talking fertility and a semen analysis is morphology. Morphology is the shape of the sperm. This is the one thing that I spend the most time talking to my patients about when we're going over their semen analysis results, because it's almost always abnormal and patients are so worried that something is wrong. So I really want to explain it. Morphology is a subjective, examination of the shape of the sperm. Most sperm look really funny under the microscope. They have 2 heads, they have 2 tails, their proportion of the head is bigger than it's supposed to be. And so a normal percentage of normal shaped sperm is 4% or more. So think about that. what test can you pass in your life where if you got 4% right, that would be acing the test? So it's actually normal for 96% of the sperm to look funky under the microscope. Okay. So a lot of my patients come back with 3% normal morphology or 2% normal morphology. And they're like, oh my gosh, all the other parameters are fine, Dr. Shahine. What am I doing wrong? Listen, abnormal shaped sperm does not mean an abnormal baby. It does not mean miscarriage. It does not mean birth defects. It doesn't mean that there's something drastically wrong with you. Abnormal shaped sperm have a lower chance of fertilizing an egg. And so the best use of this test, the best use of morphology, and especially the strict Kruger morphology, which most fertility clinics use, the best use of that test is helping counsel someone who is planning to do IVF how to fertilize their eggs. When you get the eggs and sperm out of the body and they're in the lab, you can either do conventional insemination, which is passive. You put them in the dish and you're just like, great, hope you like each other. But another way to fertilize eggs is active. It's called ICSI, and it stands for intracytoplasmic sperm injection. ICSI. So many acronyms in IVF. This is one of them. So when you're counseling somebody who's going to do IVF, you want as many fertilized eggs as you can. More embryos means, more opportunities and a higher chance in the future of success. And if someone has a low morphology, there's a chance that that could be one of the reasons that they're not getting pregnant as quickly as they want. Maybe you'd have a lower number of fertilized eggs. I mean, that's a whole nother video about ICSI and who should do it and who should not do it. But in general, this test was designed to answer a specific question. And the question is, if this patient is doing IVF, how should we recommend that they fertilize their eggs? Should they do conventional insemination or should they do ICSI? So to take a test that was designed to answer a specific question and then try to reverse engineer it and make it mean something that it doesn't, you have to be really careful with that. So I've had patients who have gotten abnormal morphology on their semen analysis and come back to me and said, okay, we got to do ICSI. I looked on Dr. Google, and this means that this is exactly why I'm not getting pregnant. And this is, I have to do IVF, even though I don't really want to. I have to do ICSI in order to have a baby. And that is just not true. It can be a part of it. It should be a discussion, but it is the most unpredictable and subjective, and just don't overthink the morphology part of the semen analysis. I mean, pay attention to it. Talk to your doctor about it. Ask about it. Make sure that it's clear. If it's 0 or 1%, maybe repeat the test or kind of look into things. But, most people have abnormal morphology. I know I'm talking about this for so long, but it's one of the most stressful things for people with sperm who are going through infertility, because the semen analysis is pretty much one of the only tests that's available to them. And they feel like they're being graded. And they're just like, oh my gosh, okay, this is the one thing that's wrong. Like, what do I do about it? And so it's just the least valuable at predicting fertility. And so if all the other parameters are normal and the one thing is a slightly abnormal morphology, I really don't want my patients to stress. It does not mean that they have to go directly to IVF and ICSI. I mean, people do use those treatments for lots of different reasons, but to do it solely for that one reason, I mean, just really, really talk to your doctor about pros and cons. Okay, so let's recap. Number one, a semen analysis is an extremely important part of a fertility evaluation for a couple. No excuses not to do it. When you are reading the semen analysis, there are key things to look at. We talked about the volume. We talked about the sperm count or concentration. We talked about motility. We talked about morphology. We also talked about why people can have low sperm count and low motility, etc. And so now, what next? If you've got abnormal values, most likely your doctor is going to recommend doing a repeat, like doing another semen analysis, because things can change day to day. It could have been a collection issue. It could have been not following the abstinence directions correctly. It could be that you're recovering from an illness. So sometimes you wait a couple of weeks and just repeat it. And if the parameters are still low, then what? Well, very often I will order blood tests and hormone levels like testosterone and estrogen, prolactin, thyroid, etc. for my male patients. And then I refer to a male fertility urologist. So this is a urologist who focuses on male fertility. I'm fortunate enough to be in Seattle, where there's a couple of incredible providers here. So these are urologists that have done fertility fellowships and subspecialty training in this. And they will often help interpret the semen analysis. Along with the hormones, they'll do a physical exam, and they're looking for things. They're trying to figure out, why is there a low count? Why is there a low motility? Is it a chronic illness? Is it a medication that somebody's taking? Is it all of the things that we kind of talked about? And they will do the physical exam and look for a varicocele. And sometimes they'll even do an ultrasound, a testicular ultrasound, to look for a varicocele. They'll think to themselves, oh, is this retrograde ejaculation? And they'll talk about ways to test for that. And so it's incredible to be on a team where I can refer to someone that truly specializes in the male reproductive health, because we can work together. And the goal is to figure out why the sperm count is low, why the motility is off, and treat that issue, because hopefully you can get the sperm counts back up. There are lots of treatment options that are available for low sperm count. If it's borderline sperm count or motility, sometimes something as simple as an intrauterine insemination will be really beneficial, because you kind of wash the sperm and concentrate it and get the best sperm past the cervix. That's why we call it a turkey baster, to really help get sperm where it needs to go. That can be really helpful. If there's a very significant low sperm count, if there's like less than 1 million sperm consistently on the semen analysis, quite honestly, I'm going to be talking to my patients about doing IVF, because in IVF, you can actually help people have fertilized eggs and embryos and babies with a low sperm count. I mean, that's one of the best indications for even doing IVF. I want to end this with some questions you can take to your doctor after you've looked at the semen analysis result, or if you've gone over them and need some questions. So number one, ask why. Why do you think this result is this way? Low count, low motility, etc. What are the causes? Are there any other tests that we could do to try to figure it out? Meaning, should I repeat my semen analysis, maybe do hormone levels, etc.? And then what could be done? Like if we repeat it and it's still a low count, what could we do? When would you refer to a male fertility urologist to kind of look for these other things that we've talked about, look for an anatomic cause, etc.? And then last question, what treatment options are available to me? Like if we really are dealing with a low count, what options are there? IUI, intrauterine insemination, IVF, in vitro fertilization. So figure out why, figure out what treatment options are available to you, and what you could do to improve your overall reproductive health to optimize your chances of having the family that you want. I hope you enjoyed this episode learning all about the semen analysis, and I hope you're taking away knowledge about how to interpret the results and what to do with the results to improve your overall reproductive health. Thank you to my team at Audiotocracy for producing the show. Thank you for being here today. If you found this episode valuable, be sure and follow the show wherever you're listening, rate and review. It really helps other people learn all about their reproductive health. You can find this episode and all others on my website at drlorashahine.com. And until next week, stay brave and curious.